welcome to the Breast Cancer Rehabilitation and Wellness Summit. My name's Denise Stewart, and today I've got a physiotherapist, Emma McGeorge, online. And Emma is has got into care for women after breast cancer and looking at the pelvic sexual health issues. Welcome, Emma.
Thank you. I'm exceptionally honoured to be here, and as Denise mentioned, I'm a physiotherapist by trade, and I have founded the Pelvic Hub because I found, going through my own pelvic issues and journey, that it was a very unrecognised area, and I thought that women really needed to know more about it. So that's why I created the Pelvic Hub, to bring products and information to women so they feel empowered to address their own pelvic health needs. Because going through with me, I saw so many people, and only 2 of them asked about my if sex was painful for me. One of them, it was just a tick sheet, and they did nothing about it to address it. And the other one was just like, okay, well, hope, you know, like she really provided me with some hope and education. And then I had a doctor telling me, oh, it must be extremely stressful for your partner. And I thought, okay, we really need to change this.
So you're going to introduce us to a vaginal dilator. Can you tell us a bit more about that, please?
I can, and I actually, so many people ask that question when I say, oh, vaginal dilator might help. A vaginal dilator is a cylindrical shape device, and it's designed to stretch and improve the width and depth of the vagina. So they're also known as vaginal trainers because they can be used to help desensitize and relax the vaginal area to reduce pain and pain with vaginal penetration and pelvic exam. So there are a range of dilators available. I stock the Sole Source silicone dilators. So this is the Sole Source dilator, and dilators come in a varying range of materials, from rigid plastic to this one, sort of like 100% medical grade silicone. And they've all got different, different positive attributes. And a woman needs to decide what dilator suits her. So you need to think about, do you want to be able to gently warm it up or cool it down for your comfort? Do you want it to be more rigid or more flexible? Do you need a bigger handle at the end of it so that it's easy to maneuver? Do you mind what it looks like? Does it bring up different feelings when you use it? There's just so many different things to consider, and so no dilators are created equul.
I'm already having a flashback of my own kind of upbringing. I miss the flower power era. And so I watched them on the TV and thought, oh my God, they're just so forward and advanced. And so when it came to, for me, thinking about a dilator, I actually had to deal with that issue of thinking, God, do I do this myself?
I know it can be incredibly challenging and overwhelming, and that's why it's so important to surround yourself with a great pelvic health team, and that's also why I talk about making sure that you choose one that suits your needs, because I know myself when I had to do it, and I have a background in obviously the health profession. I was actually a little bit non-compliant, and for me that's very unusual, especially because I wanted to get better so badly, because the products that I had just felt sterile and very medical, and it was just like, oh, this again. And so, yeah, the one thing is to find something that you don't have such a negative connotation with. And then I guess if you do have a negative feelings, or you are struggling with the concept of actually having to do vaginal dilation, then you should talk to your health professional and try and get some help from someone else other than your physical therapist, to get you through the emotional implications that might come with needing to undergo vaginal dilation therapy.
Yeah, so that's kind of like, it's that emotional thing is first, but for people that have got real problems with the vagina from the hormone changes, then it becomes a different decision, or a next step decision. And so can you just talk us through those specific problems that people experience that the dilator might be helpful for?
Yeah, sure. So according to just to sort of normalise or get people to realise, according to the Cancer Council of Australia, about 2/3 of women younger than 50, when they're diagnosed with their breast cancer, will go through menopause because of their treatment. Obviously, it's still dependent, but this is just a figure. And if a woman is perimenopausal when her treatment begins, the treatment might move her into menopause a lot more quickly, and other women may experience temporary menopausal changes. So when I talk about the menopausal changes and the vagina, the main impact is obviously the loss of estrogen in that time. Estrogen is so important for vaginal health and function. And many breast cancer survivors who have gone through menopause as a result of the treatment refer to the vulvovaginal atrophy, or VVA, as one of the most unpleasant side effects. And so many of them just do not bring it up with their health professionals. So I'm hoping that by raising awareness to it, they can at least ask the questions if the doctor doesn't bring it up with them, and not just think it's because they might not have had intercourse for a while, or it's because they're not feeling that great. So the symptoms of vulvovaginal atrophy, or VVA, can include vaginal dryness, burning, itching, pain, thinning of the vaginal walls, and loss of the suppleness and stretch in the tissues, painful sex, which is also known as dyspareunia, and possible shortening and tightening of the vagina. And so a dilator in this circumstance can help or maintain the vaginal capacity and tissue flexibility by gently stretching the vaginal walls. The other thing is that if women are experiencing painful sex, quite often the muscles around and the pelvic floor muscles might involuntarily spasm due to the pain. And it's not something that a woman consciously does, but in this situation, the dilator can be used as part of a holistic treatment to help retrain the muscles to relax. And women, again, they might start with this one, which is just the size of the little finger, and gradually progress as the body allows to retrain the body to make vaginal penetration comfortable. It can get quite uncomfortable and can be quite distressing, and once that sort of happens, it's really important to break that cycle as quickly as you can. So seek help as soon as you notice any changes there. The other thing that probably not as common within the breast cancer population, but if and within the cancer treatment, breast cancer survivors have had to have pelvic radiation at all, this can also have a big impact on the vaginal tissue depending on frequency, duration and location of the radiation. But again, it sort of dries up the tissue and can shorten and narrow the vagina, and can also result in some scar tissue, which again sort of has the same effect as the low estrogen, but the scar tissue can cause some narrowing and side effects that are potentially slightly more intense than just estrogen related problems. And in that case, after radiation therapy, the oncologists regularly recommend the vaginal dilators to maintain capacity and reduce the amount of scar tissue formation after treatment.
So Emma, can you just give me a guide, or the listeners a guide about the length of time for a treatment session? So if you're looking at using a dilator, it would be at home I'm imagining, and that it would be for an amount of time over the day or over the week. Can you guide us on your thoughts on that, please?
Yeah, well, it does definitely depend on what your practitioner recommends, but usually women in this sort of area might dilate two to three times a week if they don't have the vaginismus, if it's just for vaginal integrity and things like that. As your health and wellness might continue to improve, and you might be engaging in more regular intercourse, there will be a time where you can actually not dilate and replace that with just vaginal penetration naturally if it's not painful.
Mm-hmm. That sounds like a good goal to me, Emma.
Yeah, it's a nice end goal, isn't it? Exactly. And also being able to have pain-free pelvic examinations and just, yeah, it's amazing how much the health of the pelvis really impacts quality of life, and how many women just don't speak up and just think it's a normal thing. Yeah. So, yeah.
I think that you've made it quite some good points there, Emma. One is that it may not be brought up, and I can tell you that some people I've heard, have been suffering for years and years. So if you've addressed that problem and said that if it's not brought up, then bring it up yourself. Feel confident to bring it up. Bring it up with your doctor or with a breast care nurse, or with the treating physiotherapist that you have on your team.
Yeah, it's important to bring it up with the healthcare professional that you feel comfortable with if it's an issue that you might be slightly embarrassed about. So, but definitely bring it up, and they can talk to, if you might get your nurse to actually speak to your oncologist if you're too embarrassed to bring it up. There's ways around it, and it's definitely worth pursuing.
Yes, definitely. And Emma, the other good point that you made is that it can be a little complicated. So there's size, there's texture, there's a few things that need to be sorted. So that's why, again, it's good to have someone to talk to so that it can help the actual use of the item and achieving the goals more effective.
Yeah, definitely. And even because there's sometimes if you've got pain and a little bit of warmth helps that, or chilling it slightly, or some women who don't have so much pain but just want to really, stretch the vagina, find that there are other attributes in a dilator that really help them. So yeah, always talk to your healthcare provider, and don't just, as I said, one size doesn't fit all, and everyone has got unique needs, and it's definitely worth putting the effort in to do some research.
So Emma, you've left me, and I'm sure other people, with this visual image of this little pink thing standing up in the freezer.
And it's the silicone ones just get put in the refrigerator chilled. Oh. So you might need to put it in if you want to hide it from your sons or anything like that, or make it a little bit more private. You could probably cover it put it in a little container or something. But they can be chilled in the fridge and used, or just warmed up under hot water, like warm water, and it can make things a lot more comfortable when you've got pelvic pain.
Good. And the final thing to cover then, Emma, is that it's used in combination with some sort of cream.
Yeah, so a really big part of with the lack of estrogen is the dryness. That's the number one thing and the cause of painful sex. So then you use recommended to use lubricant or a vaginal moisturizer. And again, there is, how long is a piece of string in terms of what's out there at the moment. And I know that with some breast cancer survivors, they're not able to use hormone cream. So the lubricants that I recommend are the ones that have no nasties, no parabens, least irritating, and obviously I stock I stock them on my website, but things like Yes Organic lubricants and also the Vagina Moisturizer by Yes is fantastic. And another one that I've had a lot of positive feedback on is the Double Glide, which is a mixture of the oil and water, and it repels. Obviously, you've got a bit more glide because it repels. So that really reduces the friction as well, and women are responding quite well to that. Again, it's about looking at what's in it and what you need to look for. And I actually have just gone and made a lubricant checklist that's on my website, so women can look at what they might want to avoid and consider when choosing a lubricant. So you can just download that off my website and go shopping, informed shopping.
Nice.
Yeah.
Nice. Thanks very much, Emma. What I'll do is I'll put that link that will get people straight there, but they can go browsing over your website. And I appreciate your time today, sharing your amazing information and experience.
Yeah, thank you so much for having me. And I just really hope that women start to speak up about a bit more, because you can get so much better.